All right, so here's where we're going to go with this whole. I mean, we could easily spend the whole semester on this, but we're going to divvy it up into manageable chunks. The first part, which we'll probably do today, will deal with genetic testing and genetic diagnosis. Okay. Tuesday, we'll address the gender selection discussion. And then somewhere interspersed in that, we'll just say a little bit about the Human Genome Project and sort of what that's going to do to the way medicine is practiced. It's just, I think it has a potential to make some dramatic differences. However, the part of the issue on this is this information that we all really want to know? I think I've mentioned to you before, my wife has the gene which gives her a hugely elevated risk for breast cancer, which also gives her a risk of ovarian cancer, which she's had all those parts removed and has had breast cancer now. So, but it took her 3 years to figure out if she wanted to have the test done, and then another 3 years to figure out what to do with that information. And by that time, she had a tumor. So there's a huge amount of ambivalence on this. I spent about an hour and a half with a couple where the guy he just found out that his father had contracted Huntington's disease, which is basically it's a genetic link disease. And he was in his 30s. He thought he was in the clear, but his dad started having the symptoms of this when he was in his 60s, which is a little bit later than the norm. And so he just freaked. And so did his wife, because they were thinking about, now's the time we want to start a family. And the last time I talked to him, he was leaning toward not being tested. And he said most adults who have the history of Huntington's choose not to be tested. So it's a very interesting discussion that we had over that, yeah.
What did you mean that you said your wife, it took her 3 years to decide to get tested? What was the beginning of that?
When the test became available.
Okay.
And she had a cousin who had actually had the test done. And so the test actually for her wasn't very expensive, because all they had to do was compare the certain part of the genome with her cousin's. It didn't require a full profile. But the treatment, once you get that information, the treatment actually is fairly, it's basically mastectomies before she gets cancer. And so she was in the position of being a patient before she had manifested any symptoms, which was really a strange place to be. And she knew, I think she sort of knew from her history anyway, but once we got the genetic test back, she felt like she was, had a genetic time bomb that we were just sort of waiting for it to go off. And that, there are a lot of people that just don't want to live with that. Yeah.
May I ask how much it would cost to do a full test, and what does it involve, the testing?
The full test, just a blood test. The last time I checked, the full panel was about $2,500, and her test, I think, was about $300 or $400.
Does insurance tend to cover that if you're within a higher risk group, or is that something?
Let's just say we were encouraged to pay for it ourselves.
So that the insurance company
would not get the results. Yeah, and even though genetic privacy is still, is technically the law, I would still encourage people to pay for that out of their own pocket and not to involve your insurance company. So, but
I think
That's close to being construed as giving legal advice, so I won't go further on
I'll
that.
just put it another way. I think Satan is on the board of directors of most insurance companies.
Don't sugarcoat it there, brother. All right. Hey, one other note, too. Somebody had asked at the end of the last class period for me to close the loop briefly on how we ended up having children, which we did. We conceived them all naturally. And it turns out, my wife has a real mild seizure disorder that was easily corrected with medication. And we became aware of that. And once, in fact, her neurologist predicted that once we got that controlled, that our days of struggling with infertility might be over. And he was right. And at that point, we entered the ranks of what I came to call the frighteningly fertile at that point. Because there was no problem after that. And what her neurologist basically said is her body, there were electrical shock waves going through her body, undetectable most of the time, about 3 times an hour. They say your body was a pretty inhospitable place for a pregnancy. But had that not happened, her obstetrician would never have figured that out. So, anyway, we did. Ours was a genuinely really happy ending. So I'm grateful for that. 3. 3 wild, hellacious boys. So. Easy. Yeah, let's not go there. Okay. Okay. What I'd like to do is just think a little bit about genetic testing and some of the issues this raises and some of the things you guys need to be aware of as the couples you minister to undergo genetic testing. Okay? Some form of genetic testing for most couples is inevitable. And in fact, I think it's probably irresponsible to go through pregnancy without some form, without one of these forms of genetic testing today. Okay. Now, ultrasound is technically not a genetic screening test, but most couples have ultrasounds, once a month, once the baby becomes visible. But what ultrasound can do is ultrasound can rule out dozens of potential genetic abnormalities. With our 3rd child, my wife was 38 at the time, and she was referred to a high-risk obstetrician who did nothing but read ultrasounds for women who were over 35. And she ruled out, I'll bet she ruled out 20 or 30 potential genetic problems just by virtue of looking at the ultrasound. For example, there are some conditions like anencephaly is really obvious because the skull is misshapen. Spina bifida is really obvious because the hole in the sac that protects the spinal cord is obvious. Things like they can get an initial indication of Down's syndrome later on. So there are a variety of things that they can rule out just by looking at an ultrasound. Now, if your history suggests a need for more testing, or if the ultrasound raises red flags, or if you're over 35, then routinely you are referred to amniocentesis, okay, which I'd say for most couples, if they are committed to continuing the pregnancy, there's probably not much point in amniocentesis. In fact, our obstetrician, that's her policy. She doesn't recommend it if the couple is has an ironclad commitment to keeping the baby no matter what. Okay? Which I would encourage. I mean, we need to be encouraging that premise too. Ultrasound or amniocentesis. I mean, I wouldn't say it's the most pleasant thing for a pregnant woman, but it's the physician's guided by ultrasound, and there's sedation for the site, so it's not. I don't think it's hugely painful, but they draw off some of the amniotic fluid from which the baby has sloughed off cells, and they examine those cells to check for whatever genetic abnormalities they're concerned about. Now, there's another type of genetic test, the PGD, which we'll get to in just a minute, which involves IVF, and that's more like an embryo biopsy, where they take out, usually at around the 8-cell stage, they'll remove one cell and screen it. And so far, we've been able to do that pretty well without harming the embryo. Right? Now, it seems to me that the issue here is not about these tests per se, though the amniocentesis does have some risk of miscarriage, though it's pretty small. But the issues revolve around now what's the couple going to do with this information? Right. And I would encourage you to be aware of what I think is a subtle bias within what I loosely refer to as the genetic counseling industry. That, how can I put this best? Where I'd say the burden of proof shifts once you get bad news back on a genetic test. That's sort of the best way to summarize this. That, let's say do you have children? No. Okay. Let's say you're carrying your first pregnancy. Everything looks good, it's completely normal, and you go in to your obstetrician and say, I want to end the pregnancy. Okay. Now, the burden of proof would basically be on you to justify why you think that's okay, why you want to do that. Because he or she would probably invariably say, well, tell me why you want to do that. Okay? And I think that's right. Okay? Now, of course, under the law, you don't need a reason. But I think if your OB cared about you as a person, they would want to explore what those reasons are for doing something I think that they would consider so drastic. Right? But if you're carrying the same pregnancy and you got results back from an amniocentesis that indicated you were carrying a Down syndrome child, and you wanted to end the pregnancy, you probably wouldn't get those same kinds of questions. In fact, I think in most places, if you said that I want to continue the pregnancy, you'd probably get a lot of questions about why you'd want to do that. Right? That's why I say that the burden of proof shifts or is reversed once you get bad news back on a genetic test. Right? Now, be aware, the genetic counseling industry maintains a strict commitment to objectivity. But but be aware. That's a hard one to maintain. Now they would not. I mean, if you decided I'm keeping the baby, end of story. Some genetic counselors would probably go farther than others in trying to talk you out of that. But you would certainly have to, that they would certainly want you to be clear about your reasons for keeping the pregnancy, which you probably wouldn't have to do if you decided to end it. Okay? So I think maybe to say that there's a bias, maybe that may be a little strong, but I just, you need to have the couples that go to genetic counseling, I think they just need to be aware that they will get, they will get encouragement to end the pregnancy if there's a significant genetic problem. Right? And they will have to justify, now they can, of course they can say to the genetic counselor, I don't have to give you any reasons. But the genetic counselor, I suspect, will push them to try and give reasons to justify that decision. Okay? So I'm trying to be fair to the industry, but also, so that the couples you minister to, don't walk into something that they're not quite prepared for. One of my dear friends, he's one of the Mariners pastors down in Mission Valley, you got Mike Erie, has a 2.5-year-old Down syndrome child. And they never once considered ending the pregnancy. But I asked him about this, and I said, did you get grief for wanting to continue the pregnancy? And he said, we got a lot of hard questions. That, are you sure you want to do this? That type of thing. So I'd be aware that that's out there. What I would do if I were you is to just Google some websites that's for genetic counseling, just to see what the counselors, what they say about themselves and how they market themselves. Okay.
Are there any medical tests from an amnio that could actually be used to treat it? Would an amnio find something you could actually treat?
Yes.
Would that offset some of the risk?
Yes, and that would be worth it.
Yeah. When my first daughter was, her mom was in the hospital with preterm labor, and we were waiting to the point where her lungs were sufficiently developed so that we could go forward with delivery, and it was the amnio that determined that they were giving Maggie steroids to develop Morgan's lungs, so that when they were sufficiently developed, determined by an amnio.
Right. The other example that I think is maybe more well known is where spina bifida can be treated in utero now, which is unbelievably cool to see. You guys, if you're familiar with the Dobson photo about which shows the baby, its hand reaching up through the womb to grasp the finger of its mother. That was in a spina bifida procedure that was done. Right? What they do is with spina bifida, there's a hole in the sac that protects the spinal column. And traditionally, you just had to hold your breath and hope for the best during pregnancy and then go right from delivery to surgery to close the sac. By that time, usually a lot of the damage has been done already. Now they can go in through the uterus and close the sac surgery. It's unbelievable what they can do. So if that's indicated on ultrasound, then I'd say that's a good reason. That clearly offsets the risk. Yeah.
But they can find that one from ultrasound.
They can, but before you would authorize in utero surgery, you would definitely want to confirm that.
Okay.
Maybe overlooking or confused here. How is an ultrasound connected with genes?
Just because
The genetic-
it's not. Technically, it's not. But it can rule out a number of genetic abnormalities that have clear physical symptoms.
Gotcha.
No, but that's what I was going to say.
Yeah.
This is a way that you can detect the indication of the genetic defect by virtue of being able to see.
That's right. Right. Okay. Now, again, amnio is probably the only way to be sure about that. But some of these ultrasounds are pretty clear. Okay? All right. Now, what you need to be aware of here is all of these genetic tests have a margin of error. Okay? And there's some, like California requires, not requires the test, but it requires you to be offered a test called the AFP test, alpha fetal protein, which is just a blood test. But if there's a high amount of alpha fetal protein in the blood, that indicates that there's some sort of neural defect. There are tons of false positives for AFP. We tested positive on our first AFP test with our first child. And it was a month before we get it confirmed. And it was a month of high anxiety waiting for that to be confirmed. Okay? Amniocentesis, I'd say the margin of error on that is significantly lower. I mean, that's pretty unusual that they'd goof on amniocentesis. But what the test really can't tell you is what the degree of deformity will be, what the quality of life for this patient will be. Because that depends on a lot of things. As you know, some cases of Down syndrome are fairly mild, and some are a lot more severe. And you can't tell what that's going to be from the genetic test. In addition, the level of care for some of these genetic abnormalities has significantly gotten better. Right? Kids with cystic fibrosis today are living longer than they used to. And in some, the quality of life is better because the way we treat the technologies for treating the symptoms is better today. So I'd be careful about overgeneralizing that just because there's a genetic abnormality that the child is confined to a hopeless life of misery and suffering. Okay? Now, when it comes to, it's actually that generalization that's so problematic. Because I think in most cases, not all, but most cases in which couples end a pregnancy because of a genetic abnormality, they are doing so primarily, but not exclusively, because of the burden on the child. In my view, I think we at least ought to be honest about acknowledging the burden on the parents for raising a child with these kinds of challenges. My concern is that we often get those confused. And if a couple's going to end the pregnancy because of the burden on the parents, be honest enough to say it that way. But don't masquerade, don't hide behind the burden on the child if the burden on the parents is the predominant reason. Right? Now again, I'm not trying to downplay the challenges of raising a child with these kinds of abnormalities. Only if you're going to do something as substantial as end the pregnancy, be honest with yourself about what the reasons are. Okay? Now, part of the reason for doing that is to get at the assumptions that underlie that decision. Because assuming that we sort out the motives correctly, and the couple is ending the pregnancy because of the burden on the child, I'd want to be really careful with a reason like that. Because the conclusion that the child's life is somehow not worth living is, in my view, a presumptuous value judgment that is not ours to make. See, what would happen? It'd be very interesting, in my view, to do an informal, anecdotal poll of these kids who have these genetic abnormalities, and to ask them if they think they would have been better off never having been born. Okay? I suspect that they look at you like, what kind of a question is that? And I think the decision to end the pregnancy because of a genetic abnormality many times equates disability with unhappiness.
Just ask healthy people. That same question.
Yeah, and that's
How many people wish they were never born?
Right.
They were perfectly healthy.
And you have wrongful life lawsuits.
thankfully the courts don't give much room for those, but that day may be coming. But I think for the most part, the assumption that disability makes for unhappiness is just simply false. And it's presumptuous to suggest that. Now, of course, we would also argue that the person, the unborn child with a genetic anomaly is still nonetheless a person. And we want to be careful we don't reason in a circle on this, like we talked about with the various pro-choice arguments for abortion. Because if genetic anomaly is an adequate justification for ending the pregnancy, then there's no reason not to also consider something similar with the adult genetically anomalous population. But the reason we don't do that is because of our assumption that the adults who have genetic challenges are persons with dignity and rights. Okay? It's only only assuming that that's not the case with the unborn who have those challenges. Can you make any sense out of that as a justification? You with me on that? Okay. So I'm just asking us to be consistent with the way we view genetic anomalies as a trump card that allows us to take the life of the unborn. And my point is you can only do that on the assumption that the unborn is not a person. Okay? Which, of course, is precisely the issue that we're trying to get clear on. Okay? And so you can't, that's what I mean by reasoning in a circle. You can't assume your conclusion and then go in a circle and somehow validate it. Okay, well, that clear as mud? Yeah.
Has anyone made an argument that if we were to terminate pregnancies of, say, spinal bifida children, if all spinal bifida children, their pregnancies were terminated, then we wouldn't develop the medical technology which resulted in the ability to deal with the problem?
No, not really seriously.
Okay.
I think the one that's probably made a little more often than that is it's very interesting how how we value diversity and yet are trying to sort of preemptively eliminate these various genetic diseases. Now, I'm not suggesting that having diversity is a sufficient reason for not fixing many of these diseases, and we ought to fix them if we can. But it's just ironic that we so value diversity, except in some really important areas. And there has been some discussion about, what would be lost if we lost some of the diversity in this area. Now, again, remember, it's one thing to fix a disease. It's another thing to fix a disease by eliminating the people who have it. Are you with me on that? And there's no particular virtue in stopping the incidence of a disease by eliminating those who carry that gene. Okay, now there's another way to do genetic testing, and that's with PGD, which takes embryos created through IVF and screens them one at a time. And you implant the ones that are free of the genetic disease and discard the ones that are not. Right? On the surface, this looks like a pretty responsible way to procreate children if you have a history of genetic abnormalities. But the downside of that, of course, is that discarding embryos is not any different than aborting fetuses. So I think this would be a tricky technology to utilize, given what I think is our correct view of the moral status of fetuses and embryos. Okay? So what that raises a very interesting question. Okay? And is it true? You're missing the best part here, brother. Are there situations where we would say to a couple that you ought not try to have children? Because if we're not going to do ultrasound amniocentesis and abortion, if we're not going to do PGD, then what's left? Let me tell you about this couple. This was a Talbot couple a few years ago. This is case 7.2. Where he was, the guy was in our philosophy program, and his wife was tested, had the gene for Huntington's disease, and they really wanted to start a family. And given the symptoms normally onset, are you guys all familiar with what that is? Huntington, it's a degenerative neurological disease where you just sort of fall apart neurologically. And your neurons lose the ability to make connections. It's a terrible disease. And we have not gotten all that much better at managing the symptoms, though to some degree we have. But generally, the symptoms come in the 30s or 40s. Though, it can be all over the map. Okay. Now, they really want to have a child. And they are probably, to preempt your easy solution on this, they are probably not candidates for adoption because of her eventual decline. Okay. Whether they would be candidates for embryo adoption is a little less clear. Probably the embryo adoption places that actually facilitate a full adoption, I think would have the same questions that an adoption agency would have about traditional adoption for them. But as you know, for some that want to do embryo quote, adoption, you can just buy the embryos from an infertility clinic. And the clinic will implant them, and then, you're on your own. But it's not a formal adoption. There's probably nothing to stop them from doing that as a way of adopting. Okay? But it's not operating outside the law, but it's not the same process as a formal embryo adoption. Okay? But this was before embryo adoption was available. So that discussion was moot at that point. I would certainly encourage them to look into that today as the best way to have a child. At this time, they were looking at trying naturally or remaining childless, which neither of them really wanted to do. Okay? Now, with Huntington's disease, it's a dominant gene, which means that you have a 1 in 2 chance of passing that trait along to your child. Okay? Now, what would you advise them here? Would any of you say that they ought not to try naturally to have a child? Okay. So you would say if they're trying naturally, they're not doing anything wrong.
I mean, it does depend on their family situation. If they have family in the area that could, because just looking at it realistically, if she were to pass away, the mom, is there a support system around them that would be able to be there for the child if she grows up, right? If the child grows up.
It was hard to say because he was going on for a PhD and didn't know where he's going to end up. So I don't think they had any way of answering that at the time.
Might be a life situation in which, again, I would say maybe not in that case, because if they're going to be moving around and going to be in different places, and if it is, eventually just going to be him raising the child.
It will eventually just be him. Okay, when is they just don't know. Okay. How many of you, if this were your family, you and your spouse, would try naturally? Okay. How many of you would accept childlessness? You've got to vote. Come on, everybody's got to vote here, okay?
I voted twice.
I know. And then you can vote for him. Right. How would you advise them here?
Question, is Huntington's, if you have the gene, does that mean it's a direct causal, or is it
Yes.
a predisposition?
No, it's a direct causal
it
link.
is.
Yeah.
Okay. And it's still a 50-50 shot?
Yep. It was a matter of when she was going to start breaking down. Let me tell you what they did, see what you think. They decided to try naturally. They also decided not to have amniocentesis done because they didn't want to be tempted to end the pregnancy, which I commend them for that. They also decided not to have the child tested. and to leave that decision to the child. Now, it seems to me that as the mom started to decline, there would be plenty of opportunity to explain to the child about her history. And he wasn't going to do that until it was age appropriate. But basically leave that decision about testing to the child. What do you think about that?
I think it's appropriate.
You think that's the right thing? Right? Yeah.
And also, I mean, if they can't adopt legally, I mean, they just are not allowed to. Yeah, I mean, who's to say that the child, even if the child has the disease, you know, however many years that child gets to live, I think that'd be worth it.
Mm-hmm.
And live with the mom.
Yeah, you have a 50% chance the child won't have it.
Okay, that's right.
You don't know what medical science will do in the next 30
That's
years.
also
So
true.
To make a decision to terminate or not have a child on the presumption that, I don't know,
Right, and you will get a lot of years of very productive life, normal life. Okay? Now, let's go back a little bit to this couple I was telling you about earlier, where he had just found out that his dad had started contracting the symptoms of Huntington's. And he was pretty set on not being tested. Okay? What do you think of that? How many of you, if you were in his place, would want to know if you have the gene? Okay? How many of you would not? You just would go with him and say, I mean, take life as it comes and live it out. Okay? All right? Here's what I suggested to them. And I don't think there's a principle or a virtue that can help us much with this. And so I tried to put it in terms of costs and benefits. Right? And so I said, what happens if, what's the worst case scenario if you get tested and it's positive for the gene? Right? He said, then I realized my life's over. And I said, really? Is that true? He said, what happened to your dad? You know, he didn't start contracting symptoms till his 60s. Seems to me that's not true. And he said, but I'm walking around now, and now I know I got this time bomb. I just don't know when it's going to go off. I said to him, you already have that because of your history. In fact, they had told me about a situation that happened just a week or so after they had gotten the word about her dad. He was rummaging around in the kitchen and had dropped a bunch of pots and pans on the floor. And both of them immediately started to think, oh my God, this is it. It's starting. I said, you're already living as though you are positive. Okay? So I said, what's the downside? Really, what's the downside on this? Okay? I said, if you get tested and find out you don't have the gene, the upside is huge, right? Because now you can have a child naturally in good conscience without any worries about passing along this gene. In fact, his wife made a really interesting comment. She said, I would be bummed if at age 50 or 60 it became clear that he was not going to develop the symptoms and we decided to forego having children naturally. Said, and so I just sort of trying to be real gentle about this, but I said, are you listening? that's really important to your wife. And so, I'm not going to tell them what to do. But it seems to me that the benefits of being tested, in this case at least, significantly outweigh the costs involved. Because they're already living with the downside, it seems to me. And I think most people live with the downside. Now, granted, it's different. If you know, it's different walking into a building that might have a bomb and walking into a building that has a bomb. Those are two different things, right? So I understand his reluctance not to walk into the building he has the bomb. But he's basically living that way already. Yeah.
I think from a medical perspective, I would want to get to know a little bit more about the patient, because some patients cannot withstand what it is that their condition is currently at that present time. And if they have a sense of combative behavior or a history of...
That's right.
I would really want to get to know about their labs, the data.
But that's what I call beneficent denial. Denial that may be good for you. No, but that's certainly true. And I didn't get to, this was just one visit over coffee. But this is a good reminder to follow up with them and just kind of see where they are on this. But anyway, these kinds of things, it seems to me, are situations that we find ourselves in by virtue of our previous moral commitments to the full moral status of fetuses and embryos. Because if we didn't believe that embryos were persons with rights and dignity, PGD is no problem. And we just say, implant the embryos that don't have the anomaly.
Biola University offers a variety of biblically centered degree programs, ranging from business to ministry to the arts and sciences. Visit biola.edu to find out how Biola could make a difference in your life.